And vaccine also, as I said, children, because 80% or 100% of children already face a natural infection. We have to see the cost. 36,000 crores we have spent in the first round of vaccines in adults. Another thousands and thousands of crores we will spend. Children are not dying of COVID. Children are dying of typhoid. Children are dying of dengue. So better to use the money for children are dying of diarrhea. Safe water is not available. So it's not a good public health policy to spend. Public health means not one disease. Public health means the big disease, and you prioritize where we are losing more children. Then adverse effects, we don't know the long-term adverse effects. These are the emergency use vaccine. We don't know adverse effects. So vaccine is not a panacea. Suppose the mortality from COVID had been 20%, even 10% or 20%, then it is worth taking a chance with a vaccine. But the mortality in children is 1 in 1 million. So vaccine, we don't know the long-term harm. Short-term, also anecdotal, there have been certain unfortunate events. Clotting of blood. Myocarditis is well known from the European data set. We don't have that amount of good data set. Myocarditis, some inflammation of the heart. We don't know heart. We have to, all his life, the child has to live with the heart. Any damage, scarring, anything, we don't know what the long-term effects. So is it worth it to take that chance when the mortality is 0.001 in child? Had it been 10%, 20%, what take a chance? So we have to, this requires debate actually. So as I said, we should know what are the other killer diseases. And this COVID experience should be used to collect similar type of data for other diseases so that we can plan a public health policy in a proper way. Death is a death. So death from, say, typhoid, 10 to 30% untreated cases mortality. And in remote areas, it may not be diagnosed, treated by quacks. And in treated 0.3. Dengue, every year, 70% global burden in Asia. Every year, we have got dengue outbreaks and large number of children succumb to it. Japanese encephalitis, well known in parts of here. Scrub typhus. Tuberculosis kills more than 1,000 every day. And young people. And drug resistance. Even with treatment, the mortality is 5 to 10% even with treatment, because drug resistance TB is coming up. TB also, we have got a vaccine which give the child is born, we give BCG vaccine. It doesn't work much. They say it prevents severe disease and mortality. So then why don't you give TB vaccine? Because we are having 1,000 deaths of TB every day. If you can give COVID vaccine, why don't, where mortality is hardly any mortality in children? Give TB vaccine, BCG vaccine, give booster after 3 months, 6 months. Give BCG वैक्सीन टू द ग्रैंडमदर ग्रैंडफादर ऑल्सो. नाना नानी को भी दो, क्योंकि बच्चे को स्प्रेड करेंगे. जब आप बच्चे को दे रहे हैं कोविड वैक्सीन की और नाना नानी को नहीं स्प्रेड कर रहे, तो ये BCG, आई मीन आई एम जस्ट ट्राइंग टू से कि द लॉजिक, व्हाट इज द लॉजिक, public health logic. Then child deaths, 2,000 child deaths I have already said. So this is the take home message. Children cannot be super spreaders. Mortality is low. We know long-term side effects. Nobody can know because vaccines are not in use for long. And the time to sit focused before it is too late.